Good morning, Novartis management. Thank you for giving me this chance to look into structural and cultural strategic initiatives of Novartis Syndrome. Before we look into the strategic initiatives, let's look into the current pharmaceutical contemporary demands. First is digital transformation and data utilizations. In terms of pharma, definitely there's more requirement of using AI and big data to look into how to analyze the clinical trials data and as well as set a good clinical trials, as well as looking at healthcare costs, prevalence of disease and etc. As well as payer side, telemedicine is one of the key things nowadays where patients can easily do a video call, virtual call to get prescriptions and as well as diagnosis. Digital health is also important in terms of in the MOH sectors as well as the private sectors to look into healthcare as a whole in terms of prevalence and healthcare economics. Second will be drug innovations cost as well as pricing pressure. Current market, definitely everything has increased, right? In terms of R&D costs as well as healthcare costs also. Pharma industries need to look into how to balance this as well as bringing innovative medications to the industries. And as well as payers nowadays, for example, patients, MOH, private sectors, they are demanding competitive price, yet a very good or innovative drugs. And there's also competitions from the generics companies. So how to balance in terms of these demands into in terms of profitability as well as bringing innovative medications to the industry. Contemporary demand will be driving patient-centric and awareness. Nowadays, people really look into how to involve patients, engage patients. Pharma need to balance in terms of this approach as well as because the industry is very compliant and regulated. They cannot be seen biased or inducing patients to use certain medications, as well as they need to really create awareness among patients because patients nowadays they really has better awareness in terms of the healthcare as well as treatments nowadays. So this has to be balanced and how to actually focus in terms of when in this industry in terms of driving patients awareness. So with that three contemporary demand for pharmaceutical industries, let's look back into Novartis organization structures. Currently, they are driving into functional structures, which they are driving into the different disease areas. For example, the therapeutic head from immunology, oncology, in-market brand, as well as cardiovascular. And they have other supporting functions, for example, country medical affairs, as well as country value access, marketing and sales operations, as well as business excellent executions. All these report to the country presidents and the other associates where, for example, finance, people and organizations, communications, etc., compliance, all these are reporting indirectly to working closely with the country presidents and reporting to the global channels. So currently, let's look into the current functional structures of Novartis Syndrome Berhad meets the contemporary demand. For example, digital transformation and data utilizations. Currently, there's no specific functions on this. There's the only one that is business excellence and executions, really using digital transformations in terms of data, looking to how to help the internal staff to in terms of excellence in the executions as well as using the data to engage healthcare professionals, for example, using emails to update doctors, using uh, virtual calls to reach out to doctors as well as using all this data to analyze in terms of the customers trend as well as the disease areas. So improvement to look into is how to use the data transformation cross-functionally in the different functions. And in terms of drug innovation cost and pricing, there's a specific functions working on that where especially the country value and access team are looking into how to price correctly in terms of the pricing based on the country affordability GDP as well as medical affairs to really look into drug innovations, how to bring the innovative drugs into Malaysian markets. Perhaps also looking into maybe having a supporting team to which is excel in launches to work on pre-launches as well as post-launches support. Thirdly will be patient-centric and awareness demand. Currently, these are actually mainly deals or handled by the therapeutic heads, which is cardiovascular, onco-immunology in market brand, and there's no specific patient access and advocacy function, which this can be look into to work closely with the digital transformation team, how to make sure better engagements with patients with the digital. So from structural, cultural is important because cultural actually drives the people to work excellence. So currently, Novartis Malaysia has a few initiatives. For example, they have the quarterly review on their clean survey, looking at the current engagements with the team, looking at different areas. For example, how they whether they are patient engagements are focused or not, whether they have empowerment, whether they are well being taken care, they have trust, sense of belonging, etc. With that, they are driving the cultures like inspired, curious, and ambitious, getting people to be innovative as well as having empowerment, and most important also integrity to make sure they are still abide to the compliance and regulatory. And there's also emphasis on equality in terms of different equality across the whole global. Aside from work per se, well-being of the associates are being very well taken care or emphasis. So Novartis also emphasis on that. They have like mental well-being day. They have they also look into how to incorporate digitals or transformation into working, having hybrid working where the associates can work from home using digitals to engage with peoples and without boundary. Perhaps this person is best in Malaysia but working as a global role. And also they have also activities to enhance well-being, for example, like art, unleash your artists in you and etc. So with the current culture initiative, let's look into this initiative actually meeting the contemporary demand or not. For example, digital. In terms of that, yes, Novartis now is really working into like hybrid working, getting people to be more digitalized, using IT or digitals to work, and they can work anywhere at any time and collaborate with each other, as well as they also incorporate AI into their role. For example, AI into risk and compliance management. They even have IT days to actually upskill people. So suggestions is maybe look into more digital transformations alignment towards local and global, because perhaps global has good best practice learning that can actually incorporate into the local settings. Secondly, is drug innovation cost and pricing pressure. This really needs a culture where both to promote innovation, how to balance in terms of bringing innovations, yet being able to solve the solution in terms of pricing pressures. And with that, growth culture is important to get people motivated, not because of the external pressures. They need to continue to learn and develop and promote a positive and can-do mindset. Third will be passion-centric awareness. Internally, these cultures need to be embarked into the associates. Like for example, now they are doing some internal passion-centric awareness, like breast cancer awareness day and things like that. So perhaps more activities on that. So with the evaluations, my proposal is two key strategic initiatives. First is organization cultures, to actually embed patient-centric mindset and cultures into the current ICU cultures, which is the number 5 cultures is patients in our mind. Secondly, in terms of this is perhaps giving more trainings in terms of looking into certain disease patient journey to make sure associate actually embed themselves into the certain disease area as well as patient, perhaps visiting the healthcare centers to further understand how patients go through the journey, and as well as more internal patient awareness day to get patients to voice out to the associates, or maybe associates themselves to voice out their own personal feelings if there are patients, and more disease awareness campaign participation, for example, World Heart Day run, psoriasis day charities, and etc. And getting more patient involvement activities with the associates, for example, how to actually link patient advocacy group, patient advisory board with the associates. The second strategy initiative is looking into organization structures. There's no specific functions on digital transformation, so set functions for that, where this function can work closely, collaboratively with the local different functions to make sure every functions have a KPI objective of digital transformations. That's one of the KPI, to have an initiative on that and collaborate and align with the global digital team. So these teams actually can collaborate and align together locally and globally. And we look into this team also we look into the internal process, how to simplify it with digital transformations, how to incorporate AI into data analysis internally as well as with competitors, and also working into AI corporations in patient care. So this team really embark on digitals. So with that, I would like to conclude these two strategy initiative. Organization and structures will be able to bring forward Novartis Malaysia's in terms of meeting the contemporary